published in the New England Journal of Medicine. After spending 36 years at her hospital, there had been a new policy that had been brought in that basically started to rate nurses, and nurses were being pulled out for minor infractions. So she finally went to her manager and she said, what's going on with, all of these complaints? Like, why are nurses being brought out? Why are they being criticized? Why are they being rated? Why are they being brought out for minor offenses when they're killing themselves every day to be on the front lines? And after she started complaining, 4 months later, she was brought into her department by the HRs and she was fired. After 36 years of exceptional service at the hospital. Linda Boly did something different than nearly 99% of nurses in the world. She went out, interviewed attorneys, and returned bound by attorneys across her state. She said, what? I'm really sorry, but we're not going to take on one of the largest healthcare systems in the country. It's too big, it's too hard, you're not going to win. Until she found one attorney who said, I will take your case. But a case like this is not done on contingency. And after over $50,000 in legal fees, Linda Boly was the first nurse to ever win a $3 million jury award for wrongful termination as a nurse who complained about unfair workplace policy. The largest settlement ever to happen, and you might all think this is great, she's rich, this is fabulous, it's going to be great. The truth is the hospital is appealing it, it's going forward, it could appeal all the way up to the Supreme Court, but she is fighting that fight all the way through to defend every nurse who's sitting here, and it's a great honor that we're bringing Linda Boly up. She hasn't spoken in a little while, so I hope you guys will appreciate this.
Good afternoon. Thank you for the great introduction. I wasn't going to mention the jury award, but yes, it's still an appeal, and I'll explain some of that. So I never envisioned myself being notorious, but it's so comforting to be in this environment here with all of you, because I've already talked to a lot of you who have experienced the same thing, and I just can't tell you how meaningful that is to me, and I just feel so grateful to have experienced that here. So I just want to start with how I became a nurse or patient advocate, and it's just a little story, but basically I was a student once, and this was before I started working as a full RN from a 3-year program, and I was a student on a floor with a very strong hardworking head nurse, and we had this discussion. In a way, it was a fight over a box of candy that my patient had given me. And at that time, that patient intended for that box of candy to go, where, to the other nurses and staff helping take care of patients. And again, I was a fairly new student, and I asked my instructor if I could talk to the head nurse, who had immediately taken the box of candy from my hands while I was trying to put it out for people to enjoy, and asked my instructor, could I please respectfully address this with the head nurse. And she responded, "Be my guest." And so I followed the head nurse into her office where she was quietly putting away this box of candy. And I said, "Excuse me, could I talk to you for a moment about this box of candy? My patient would really like to have it out for people to enjoy, the staff that have been so important in taking good care of her." And she looked at me like, "What planet are you on?" And she said, "Well, actually, I put the box of candy in my freezer at home, and then I get to decide when I put the box of candy out at work." And I said, "Well, actually, I came to advocate for my patient, so give me that box of candy." So she actually gave the box of candy back to me after about a 15-minute discussion. And I put it back out in the doctor's dictation alcove at that time. And everybody's looking at me like, do we dare go have a piece of candy in front of their head nurse? And so I thought of that on the way over here because I think that was when I realized I started asking questions. And why I felt like I could do that, I'm not sure, except that I guess it incensed me that I understood she takes it home only to decide later, taking away your opportunity to enjoy this patient's graciousness and thankfulness. And so that was the beginning of me asking why, and I've experienced that to some degree up to the point where I was terminated, but I think the termination up to that point I had gotten a lot more aggressive probably. So in any case, I'm a 3-year RN. I do not have my degree. I would love to get my degree. I'm just in the middle of paying for college, and I still have one at home. I was a very late mom. And so I still have hopes of doing that. And then I also have a husband who is disabled early from law practice. And so I also have an Airbnb at home to help supplement my income because my income is down. With that, I do not do public speaking regularly, so bear with me. And I did want to give you some information about what happened and the responses I got, what I learned from that, and what kind of a lonely journey it is, an expensive journey, and I'll get started on that. So I have worked a lot of areas, but most recently and the longest I've worked in eye surgery or eye ophthalmology in any of the subspecialties, and I currently work in an outpatient surgery center in a large hospital system, not benefited. When I started there, I was still going into trial at that time, and nobody knew anything about that. And what happened was, after I was hired there, my boss was subpoenaed to testify for both sides. My side on as to how capable I was, and if I had had any problems, and also they wanted him to testify for the other side, which was the hospital system that I worked in. So that was very stressful. I thought it was stressful enough to go into trial, but to then have your new workplace pulled in and for your attorney to have to talk to the hospital system's attorney, and you are already notorious from the get-go working there, I wasn't sure I still had a job. So I was a nervous wreck. And so I do pre and post-op mostly in my job. When I was terminated, I was a pre-admitting nurse for a couple years in a surgical service unit. We serviced a day surgery and a short stay unit. And so when I was terminated, I had only been in pre-admitting 2 years, but 2 years off the floor is a long time. So, so my story goes like this. One day I was called into the manager's office, and this was the second time. And the second time for the same thing, which was not being productive enough. And again, I was in pre-admitting for surgery patients. So what they called the number of patients or metric for that area was an arbitrary number which was actually 8 to 10 patients a shift. And it kind of morphed into 8 to 10 patients in a 8-hour shift, or over 10 patients in a 10-hour shift. That was all over the board. So this was a number that two managers decided to call the productivity metric that they needed to in order to meet their budget, given the staffing allotment and so on. So I was not doing, according to my manager, enough patients. I was working with a longtime nurse who I'd known for many years, and she retired, so I took over in her position. And we did not have a unit secretary, we did not have anybody to make up our charts or receive all the documentation that you receive, like your EKGs and your history and physicals. And we were having to put orders in, call doctors, get their orders, put them in the computer. So none of that was being accounted for in the work that I was doing. And oftentimes I was working by myself. They would say that they would give you staffing for the week that your associate was out, but that did not happen. So when my manager called me in the second time, she said, you know, you're still not doing enough. I calculated this one day, I had not met the metric. And I said, so, okay. I said, are you taking into account that I didn't have anybody working with me? No response. I asked her, did you take into account that we're being asked to go home early because of the budget? You say. Or are you taking into account that maybe I had to take an extra hour or two off for a medical appointment? No response. And I was written up, and I was pretty depressed going home, wondering, you know, what is this about? Some of the other nurses have been called in, and they were asking me, because I was senior, what's going on here? Something's changed. I know we're rushing patients, we're speeding patients through the system, trying to be efficient. We got rid of the holding room for PACU so that patients are now just coming directly back, and whether you can take a patient or not, with or without report, they're coming back, and you may be busy with another patient. Not to mention the patients are being forced to get out of bed and sit up in a wheelchair, lined up in the hallway, waiting an hour for their ride to come because you're turning beds. This was the new day surgery unit that had become, at that time I didn't know, the model for, if you haven't heard it, it's called productivity management. Has anybody heard of productivity management or productivity metrics? Just a few. Okay, and that's not uncommon. If you've heard, it's been a little more time, so hopefully information is getting around. Whether or not you heard about it from your hospital in a positive light is one thing, but certainly when I was working, our hospital system was not transparent about it. They had told us about lean management, which we all probably recognize now, that was how to run efficiently via the way Toyota ran. But productivity management is a consultant tool that hospitals buy, corporations buy, all businesses buy if you have a certain number of employees, and even churches buy this tool. It's very expensive. It's consultants come out and they train all your management. That takes probably a year, who knows how long. And then it is a system where you are talked to very frequently. Any employee, this could be a housekeeper, whether you're a nurse or housekeeper, anybody in between. And if you are working, you can be pulled out of your workflow. Any minor conversation as to how you should do something or not do something, or any communication, is required to be documented in a person's file by the supervisor or manager. And so all of this is set up so that ideally, depending on your manager, you are to be coached in how to be more productive. And in this case, we'd already experienced the hospital speed-ups, but the idea was to coach you in a positive way, positive reinforcement. That was the intention of it. Unfortunately, human nature is such that most people would have to be taught how to do that. We're all not as good at positive reinforcement maybe as we think we might be. And I can honestly tell you that most of it, if not all of it, was negative. What I had experienced, there was no positive feedback as to your work at all. And so it's a setup for preparing to terminate you if they need to, if you're not being productive, if you're not doing X number of patients in a certain amount of time or for the shift. If it takes you longer than nurse B or C or D to admit a patient or discharge a patient or whatever the task is, then your numbers are held against your associates' numbers, and the lowest productive person is the one that is targeted for termination. And churches use it. I have a brother-in-law who's a Jesuit priest, and he said, I know what productivity management is. It's to get rid of people. I said, yeah, that's what's been happening, all right. The only thing is I would say is that in my case, it was getting rid of the older nurses. And I was the oldest nurse in my unit. I had probably the highest salary. I had that old pension, which was frozen at some point, but still more than a young nurse would cost. I'm more expensive in health care when they've got you insured. So I take more time off, maybe because I have parents or family members that are sick and need help, or whatever it is. The older you get, they just view that as they're paying more, they're losing. So when I was called in the next time, I said, well, actually, when I went home from that second time, I went home and Googled, why am I being called in so often? And I just couldn't think of anything else to do. And so up comes productivity management. And so I started reading about productivity management or productivity metrics. And that's where I learned about what it was. And now, 3 years later, productivity management, while it's still being used, is being revised somewhat. But it's still, it is a way of, its intention again is to be positive reinforcement. However, again, that depends on your manager and their skills. But almost invariably, it ends up terminating someone. So in my case, I was the oldest nurse. The hospital that I worked in, including other hospitals in the system, were also terminating older nurses. They continue to terminate older nurses, and so still happening. So I go back to my manager and I tell her, I think I know why I'm being pulled in. And she was silent, and I said, I Googled, why am I being pulled in? And it said productivity management. And I said, how long has this been going on? No response. And I said, maybe as far back as 2006, when hospital speed-up started in our system. And then she responded, well, maybe a year and a half. And the difference between her opinion of how long it had been administered was quite different from mine, because I was experiencing, not knowing about it, the hospital speed-up issue, and she was telling, which was probably about 7 years, and she was saying it had only occurred for a year and a half. So I said, that's interesting, because nobody knows about this. None of the nurses know why they're being pulled in. They come to me and they say, what's going on? And I say, look up productivity management. And I said, would you be willing to discuss this at the next staff meeting? And she had a long pause, and she said, well, yeah, I'll think about that. And the next staff meeting came, and no discussion. So I wasn't going to stand up at that time and say, hey, wait a minute, let's talk about this. But, so she never talked about it. And so the process kept going for me. It's basically a verbal correction, and then you get 3 strikes after that. You get one written corrective action, you get a second, and then your third is meaning you're being terminated. So I just want to look here a minute. So she never discussed it. And what I really want you to know about it is, if you didn't know about it before, is that metrics or productivity management is really, rather than productivity, something that we're doing, It's really more about financial metrics. They need to get as many patients in the door, they say, to increase their volume and therefore increase their revenue. So that's what this is really about. The problem with that is, in my case, and in a lot of cases, these are arbitrary numbers that are set. And ideally, in Oregon, we have a nurse staffing law. And we are required to have nurse staffing committees in each hospital, and as well as in each unit that are supposed to have these things run through them as to any staffing issues, productivity issues, numbers of things that you do, anything like that. I don't know about other hospitals, but I know in the Portland area it's not. They may have staffing committees, but they're not using them. The CAO of the hospital I worked in, who's a physician also, actually testified that, first of all, he didn't know there was a nurse staffing law in Oregon, and secondly, that he understood that the nurse staffing committee was really set up to get rid of older nurses. And so I didn't hear that till after trial, because I think that may have been in one of the depositions. But I'm not sure that it would have ever gotten run through the staffing committee then or even now. So you have to understand that the numbers of things they want you to do and the amount of time it takes to do them in, they want to be able to dictate that to you. And so if you are not, in their view, performing the way they think you should, even though these numbers are arbitrary oftentimes, when they're not arbitrary, what they're doing is they're paying money for what they call benchmark data. And benchmark data, I don't know how much they pay, but it's a lot, where they get information on how hospitals across the country are doing metric-wise in each state, for each different type of unit you work in. The problem in my case was that there was no benchmark, so to speak, or average number of patients that a pre-admitting nurse does. It was not measured because the pre-admitting nurses in most hospitals are counted into the surgical services, day surgery and short stay areas, so they didn't separate that out. But for other areas like med-surg or maybe surgery units or ICU or whatever, there are benchmarks for numbers of patients or whatever it is they're trying to get information on. So I guess what I want to say is it was a 1, 2, 3 strikes you're out, and so in a matter of 4 months I was terminated at age 57, and I had been there 36, 37 years. I actually went to school there, nursing school, and that's no longer there. And so while I was very loyal and was working very hard, I think one of the write-ups was for working off the clock. And I know you're not supposed to work off the clock, but I don't know anybody that in my system that wasn't working off the clock. And does anybody experience that in their system, working off the clock? And depending on your manager and if you're being targeted, they may or may not care, or may not, even though they profess, they have trainings for us that say never work off the clock. And even though the nurse that I had worked with for so long, and then she retired, she was probably the one that did it the most, but she was never called out on it or written up for it. And I know that there's floors of nurses like labor and delivery where they sit, and after they clock out, they do their charting. And the only one that gets called out on it is the one that they're targeting for termination. And maybe if we had better staffing, that wouldn't be an issue. But during the trial, it was a 2-week trial. Yes.
I have a question.
Yeah.
I'm sorry to interrupt, I'm just really curious. How old was your manager?
I'm sorry, I couldn't hear you.
How old was your manager?
My manager was, I thought she was the same age as me, but she was 1 or 2 years older, it turns out. And she was actually a social worker before she became a nurse. And I learned, now, is there any social workers in the room that have been a social worker? I learned that the philosophy is a little different with a social worker than maybe with a nurse. And that is that, at least this is what I understand. I had to kind of validate this with a psychologist that I was seeing. And it was, the theory is that you should always be able to pick yourself up by your bootstraps. But the problem is, their belief is that even if somebody cuts your bootstraps, you should be able to carry on. And I don't think that's a general nursing view. They kind of like, nurses like to know why and what's happening in a little more specifics. But so she actually quoted that when she introduced herself to us when she first became our manager. And I thought, well, that's interesting. And so their philosophy is a little different about how you should be able to carry on. It's not that we don't do that, but they expect that. It's an expectation. So it's just different. And let me think here. So after I was terminated, just before I was terminated, I wrote a grievance and an addendum to the grievance. I emailed it to the CAO, and then the day that they terminated me, they called me into the office. They said the night before, you have to show up at 9 a.m. and you ask them, well, how can I prepare for this meeting? What is it about? They refuse to tell you. And you say, well, I'd really like to prepare for it. Can you tell me what I need to prepare for? No, they won't tell you. And so I walk into this meeting and they're ready to terminate me, HR and another HR person and my manager. And she hands me this note, which is supposed to be my letter of termination. They didn't ask me to leave by escort. They do ask, for your badge, but I didn't get escorted out, which is actually usually the case, and I'm not sure why that was. But I had already had my things that I had emptied out of my desk. I just had this strong feeling. And I didn't say anything other than I said, how could I be so unproductive that you would terminate me after 36, 37 years, and my evaluations have been basically ideal up to this point. I've even met the metric, and there was a long pause, and my manager said, well, you have slowed down. And I looked at her and I thought, wow, I do the same as I always do. I haven't done it any differently. If we have help, I can do more. If we don't have help, I do less of what they're counting as a metric. If they don't give you a unit secretary and they're not counting all of that work, that's a big difference. So what can you do about that? Nothing at the moment. So I go home and I pre-scheduled a meeting with the CAO, and they had figured that out ahead. And they had figured out that they would terminate me that morning, hoping that I wouldn't come back and talk to the CAO about my grievance. And by the way, in the termination, I told them again about my grievance. I had not heard a response of any sort. I was concerned about age discrimination. I was concerned that I was being singled out, that I was as productive, if not more productive, than some of the pre-admitting nurses. And I knew that because I worked alongside the short stay pre-admitting. And none of them were getting called in. So I left, came back, I took a nap, came back, talked to the CAO, and again, this is a guy that I knew when I was doing eye research. He was an MD, PhD. He had invented the first artificial blood for wartime. But he was in the position now of running the hospital. This is really not his forte, but that's where they had him. So when I talked to him, he understood. He said, I realized they threw you out on the floor after they figured out you were meeting the metric after they were calling you in. So they take away your job and put you in another job where you haven't been for a long time or ever, and give you a week of very light orientation. You're supposed to know the workflow. He said, that's not enough. And I said, you're right. I appreciate you saying that. But again, after all was said, he said, I'll have them check into this. Did not hear anything. They refused to reinstate. So I did have an attorney, and I only had an attorney at that time because we did know someone that we were hoping would take it. And I wasn't sure that he would take the case. He had never done employment. Well, he had done one employment case, but it was not hospital related. But he did win a large sum. So he took the case. I went along very reluctantly. I wasn't sure if I could take the stress of it because I had to be looking for a job. And that's hard to do when you've been terminated. I did really take that to heart. And I found out real quickly age was against me. The unemployment office did say that for nurses, you'll be lucky if you could get even a long-term care position, at least in my area. The hospitals did not want to hire you because they were terminating nurses. This was well known at the unemployment office of all places. And along with me, there was another nurse who had been terminated in our meetings for unemployment, and there were attorneys even that couldn't find work. So it took about 2 years to develop the case, and in the meantime, it does take money to pay for the expenses, even though it might be on contingency. And most nurses honestly cannot do that. Most nurses, from my understanding, are probably single with kids nowadays, and who can afford paying for costs. Thank you. And so, to make a long story short, I went through the trial. It was 2 weeks. I was very symptomatic, stress-wise. I didn't have to testify till the end, but basically, our side had all the evidence. that they had lied all the way through every step of the process. They never read my grievance. They predetermined they were going to terminate me. They based the metrics they were counting of what I was doing, again, only on, pre-admissions, not these other things, but they were basing my termination on specific days I didn't meet the metric in a month. All of the nurses were doing the same thing. However, for some reason I was being singled out. The way I was being counted on numbers of patients was different from the way other nurses were being tracked on numbers. So each person, the manager, the director, HR, they all blamed each other in testimony, saying that they should have done it differently, and if they'd known that the other person was doing this or that, they all actually didn't know what each other was doing because it was all in their emails. They still refused to reinstate me, which is, after all that stress, was fine by me. And it hasn't stopped. The jury found in my favor almost unanimously. It was just one, I think, jurist that did not vote in my favor on one thing. So basically, it was $3 million settlement. However, you have to understand that your attorney gets up to 50%, and sometimes it can be more. It depends on how much work they put into it. And this guy didn't sleep. You have to know that if you get punitive damages, which I did, 70% of that goes to the court to fund people that can't afford legal help. And basically at the end, you end up still behind. You end up with probably out of $3 million, a little less than $1 million. I know that sounds like a lot, but you have to understand that it's taxed 30%. So that's maybe you coming down to $500,000. And then you can figure how much you lost. And it's still, you end up still being short. If you had still worked your full time and even though everything's calculated professionally by somebody who does that, a CPA in this case, you still end up short. But I learned so much. And if I could, I'd only do it once in my life. But I did learn a lot. It was very, very hard. I think that it's not done. It's still an appeal. Right now it's going to the state court, and when that finishes, if the judges decide that they're going to vote in my favor, then it's done. But if not, then if they allow it, and they can, the other side, which is the hospital system, can appeal it to the Supreme Court, so it can go another 1.5 years or 2. So that means it's been 4 years. It can go another 1.5 years at least. And in the meantime, you're trying to make your bills, and you're paying your own insurance. Okay. I think that's valid.
You know what? I admit that, Linda, this is a tremendous story. I think you guys have to give Linda a round of applause for standing up. Process to come. So please be your supporter and look forward to talking to you. Thank you so much.